So, why do students avoid strict colleges in big cities and choose low-cost, budget-friendly colleges in Russia instead? What are the strict rules set by the National Medical Commission for students pursuing medical education abroad to practice in India?
So, integrated internship is not allowed. So, all these questions are very, very important. And what happens if this entire degree becomes invalid? So that is why the students and the parents are worried.
Namaste everyone, welcome to the AKEC podcast. They say quality education is not an expense. It is an investment into your destiny. Today, we want to make sure your investment is safe. Re-NEET broke many students' dreams, forcing them to look into a broad, affordable and budget-friendly MBBS option. But beware of flashy offers. One misrule of NMC can ruin your entire career. To guide you safely, we have India's top leading educationist, Dr. Amit Kamle, with us today. Watch till the end to uncover misleading traps and to see if studying abroad is meant for you. So what challenges do students and parents face due to the Re-NEET exam? And what has the overall impact been?
See, overall, the students are mentally exhausted because of Re-NEET. Apart from anxiety and stress, the academic motivation is lost. Also, they are not sure from where to restart their career. Then the cutoff marks has drastically shifted. There is a dilemma in the parents because they are undergoing an emotional stress. So the overall impact that this Re-NEET has done is definitely an uncertainty about the students' future and their career. The registration rounds are running in a delay, and that is why there is only limited time for the parents and students to come to a decision. Now, if they want to take a gap or a drop, they are unsure what lies ahead in the next academic year. And then if they plan to study abroad, the NMC guidelines are very, very strict, which were always there in place, but the students, however, were sure that some way out could have been achieved. And the recent inflation, if you see the prices in the market, everything is become so expensive. So the parents and students find it very difficult to predict what would be the expense for the MBBS course if they are planning to go abroad.
So, why do students avoid strict colleges in big cities and choose low-cost, budget-friendly colleges in Russia instead?
Nowadays the students are more inclined towards lifestyle than the quality of education. Similarly, they like to be in their own comfort zone, and the priority is comfort over compromise. All the premium medical universities which are there in Russia, which are located in the metropolitan cities like Moscow, St. Petersburg, Kazan, Volgograd, they are very strict universities. So they require 100% attendance. And even if there is a small mischief or some attendance issues, those are directly informed to the parents by these colleges. So the students feel that they are under some control and that could limit their freedom. Also, there is a very, very important thing that all these universities, majoritarily, they focus on the academic curriculum. And no doubt there is extracurricular activities in these universities, but the primary focus is on the academics, which many students prefer to have more extracurricular on the campus. These universities are extremely strict on their discipline. So if the parents and students want to see a success in their career, so the first step of it should start with discipline.
Great. So, and what is the eligibility criteria to get admission into government medical schools in Russia?
The student has to pass 12th standard with science. Open category candidates should have 50% marks in physics, chemistry and biology. Reserved category candidates should have 40% of marks in physics, chemistry and biology. Along with that, they need to have their caste certificate and their caste validity. All these students should be NEET qualified. For the 2026 batch, for the open category candidates, it is 213 marks. For reserved category candidates, it is 177 marks. Now, this NEET score for study abroad is valid for 3 years. So, all the applicants who have qualified NEET in 2025 and 2024 can apply as well. For the 2025 batch students, for open category, it is 144 marks. For reserved category, it is 113 marks. And for 2024 batch, the open category candidates should have 164 marks and reserved category candidates should have 129 marks. Remember, if you have not qualified NEET, you won't be able to apply in any Russian government medical colleges.
And so due to the admission delays in India, can students still get admission into top government schools in Russia?
See, the academic calendar in India and in Russia is pretty similar. But because there was Re-NEET, the calendar has shifted drastically. The colleges in Russia usually start the academic semester from September mid and it goes on till October. But because of the delay, the top and best premium universities conduct entrances before taking their applicants. Now, because they have limited seats in their colleges as well, the students who already has identified their score and who know that they are not going to make it to the government medical colleges in India should hurry up and apply to the premium universities first, because these premium universities conduct their own entrance examinations as well, and they are pretty strict with their format, and they also have specific dates on which these entrances are conducted. So if the student has not decided, and if it is difficult for a parent to come to a conclusion, then unfortunately the students might not get premium universities. They might land up in small towns or villages of Russia, where they in any ways accept a lot of Indian students, but the students have to prefer to study in quality premium medical universities.
Are Russian universities conducting their own separate entrance exam for admission after Re-NEET?
Mostly the Russian universities have their own entrance examinations for the Indian applicants. Some universities also conduct aptitude tests. The premium universities conduct entrance examinations on physics, chemistry, biology and English on specific dates which are on the website of the university. So these premium universities accept only those students who qualify the eligibility criteria and who have passed their entrance examinations. Some universities take only those students who have topped their entrance examinations. Also, some universities will ask the students to remit one semester fee amount before they start their admission formalities as well.
What are the strict rules set by the National Medical Commission for students pursuing medical education abroad to practice in India? Also, can you take us through the difference between screening test regulations in 2002 and NMC regulations in 2021?
The screening test regulation of 2002 and the NMC guidelines of 2021 matter the most for any career these days. So one has to understand those students who went to an institution outside India for medical studies before 18th November 2021 will be under the screening test regulation 2002, which means a student who is a citizen of India and who has traveled abroad for medical studies has to complete the medical course in that country. The duration is not specified, the language was not regulated, and after the degree program from that particular university, the student could come back to India, give the FMGE examination, and then after successful passing of the FMGE examination, he could obtain an registration and then undergo 1 year of internship, that is 12 months, and then he will be granted a license to work. Now, what happens to the students who have gone abroad after 18th November 2021? This is where the NMC regulations of 2021 come into force, where they are pretty strict in the duration of course, which is specified as 54 months. So the student who has gone in a particular university in a particular country has to complete his or her education from the same university in complete English medium of instruction. After the course, which is of 54 months, the student has to undergo 1 year, that is 12 months of internship after the course is completed. So integrated internship is not allowed. After the internship program is done, the student will have to now obtain a license in the country where he or she has completed the medical course at par with the local students who are citizens of that country and who also require a license to work after their degree program. So once an Indian student obtains the license to work, he can then return to India, give the FMG examinations or next whichever exam is applicable, and then once he successfully passes this examination, he has to do 12 months of compulsory clinical rotation in India as well, and after which only he or she might be given a license to work in India. So now this whole thing has to be done by any student in 10 years.
Why is it so difficult for parents to allow their children to study in Russia?
See, now it's not about a particular country where the parents had a confusion which country to select. It's not about Russia or any other country. It's now about the clear guidelines that has come from the National Medical Commission. So the parents are in a spot of bother, they are in a fix, because now no consultant or no agent or no one could be an intermediate, because all these regulations are in place by the National Medical Commission and it has to be satisfied by the university which they have selected, and it depends on the country where they have chosen to study. The students are worried if the university will not take any responsibility. What if the university doesn't help? What if the university violates the NMC guidelines? Now the students go to study there on a student visa. Now they also have to do 1 year of internship, plus they also have to obtain a license. So they have to convert their study visa into a work visa might be. So what if the hospitals or clinics doesn't sponsor the students? So all these questions are very, very important. And what happens if this entire degree becomes invalid? So that is why the students and the parents are worried. It's not now about the budget or I am eligible and anything apart from this. Those students who can still sail from these guidelines and complete all the formalities, only such students who are self-accountable can take admission this year. This is my personal opinion.
And why do you think students should avoid taking admission in cheap or low budget universities or those located in small towns and villages in Russia?
See, no doubt Russia is a very big country, but it has a less population, and majority of the population in Russia stays in bigger metropolitan cities for work, for education, for good health care, for good hospitals, good doctors, whereas the population in small towns and villages is very less, and they have limited clinics, limited hospitals, and because of the low pay scale, or they have underpaid staff. So what happens, the students go there because it fits into their budget, but from where are they going to get the patients, because the clinical volume on a daily basis is going to be low, so they are not going to get a clinical exposure and practical training, and they will have to rely only on the theoretical knowledge and external apps from where they are getting knowledge. So such students, once they come back to India, they unfortunately do not crack the FMGE. Now suppose a student has saved up to 2 lakh Indian rupees in a course in Russia, and what if such students fail the FMG? He will again have to invest the same amount of say 2 or 3 lakh rupees for his coaching, for his registration, for his food, stay, everything, and he loses 6 months as well. If again the student fails, again that much amount is going to go. So it is very important to understand this, because he is not only losing the precious years, but he is also not earning his income as a doctor as well. So he is losing out on that part of the income as well. So it is very important to invest in quality medical education abroad. Initially, the tendency was like, even if we go to any college or any city, any country, it was okay. We will go there, we will study hard, and we will come back to India, give the FMG examination, and start working as a doctor. But the scenarios have changed. This mindset needs to change, and if you see the FMGE June 2026 result, it is on a declining side. Only 13% of the students could crack the FMGE examination of June this year.
The recent FMG 2026 results were very worrying. Only 13% pass rate. What do you think is the main reason behind this?
See, for the June FMG 2026, 37,000 plus students appeared, out of which around 32,000 plus students failed the examination. So overall, 12 to 13% students only could crack the FMG. Now these students have gone into the universities which according to them is the best university which they could probably find for themselves. So the overall reason what we feel is the quality of education in India and the quality of education abroad has a severe impact. Then the second thing is the language barrier, because no doubt the students are studying in English medium course, but still the patients are going to speak in their local language, and many a times it happens that the student ignores the local language, and thus in doing this he or she is not able to write the clinical cases because he is not able to communicate, and then he is not able to put a diagnose, and ultimately if there is no diagnose, there is no treatment. So again the student relies and he is depending on the theoretical knowledge. One more very important thing in this is the disease profiles could also be a mismatch in particular countries. Then certain small towns and villages, the universities which are located in this part, what happens with them is they conduct some MCQs tests or vivas for them to internally pass the students. Now in India we have written examinations, we have orals, we have practicals, and we have even concept-based tests. So because of this easy format of examination, the students are accustomed with this format. And when they come to India to give this FMGE examination, it is an extremely difficult examination and a tough examination. So this is where I think they fail to understand. So hence they have to choose universities which know the standards, which cater and which provides only quality education.
Okay, got it. And what is the total budget required for a top government medical school in Russia?
Yeah, so every academic year in Russia has 2 semesters. Every semester is 5 months, after which we have 2 months vacation. So a premium university based in Moscow, St. Petersburg, Kazan or Volgograd would cost every semester around 2 lakh to 3 lakh rubles, which include the college fee, the hostel fee, medical insurance, medical checkup, visa extension fee as well. Apart from this expense, the student also has personal expenditure for food, for internal transportation, and for mobile recharge, which could be around 8,000 to 10,000 Indian rupees. Now the air ticket prices have also been rising of late, so parents have to be thoughtful and careful about this, that the fares are pretty high.
And what about the hostel facilities for Indian students in Russia?
So all the universities with whom we partner are government universities, and they have government hostels. So in some universities the hostel is in the campus of the university, and in some universities it is in the city center, around 3 to 5 stops from the main university building. One has to understand that not all the classes would take place in the university building itself. The students move along within the city limits at different clinics, hospitals, polyclinics within the duration of their course. Now every room has a bed, a study table, a chair, wardrobes, there's heating facility, there's hot and cold water, toilets, kitchens, recreation room, study room, sports complex. So the grocery store, the pharmacy and the police station is nearby. We have bus stops, tram stops near the hostel premises, and all the hostels are under the surveillance and have security guards, so strangers cannot come inside without permission.
So how safe and comfortable is it staying there?
It is very safe because the hostel is governed by the university, and these are government hostels. In case if the student wishes to move in a private accommodation or in a private apartment, that can be done in certain universities with the written permission and consent of the parents only.
And what about Indian food? Is it easily available for the Indian students in Russia, and what options are there?
Yeah, so nowadays vegetarian and non-vegetarian food is readily available in the bigger metropolitan cities of Russia. We have private Indian mess, which doesn't belong to the university. It's a private mess. Then we have Indian restaurants spread across the cities. We have tiffin services. Also, there are attached kitchens in the hostels, so students can cook their own food as well. So one has to be careful in villages. These private mess organizers, they collect the payment for one entire year. Whether you like the food, you don't like the food, that is not their concern, but this is how they operate. But in bigger cities, it's not a similar situation. If you like the food, you can order the food or you can cook it for yourself.
And who travels with the students to Russia?
Yeah, so our students do not travel alone anyway. They move in groups with our student coordinators, and I personally travel with the student group as well.
So how can students and parents meet you in person, and how can they apply for MBBS admission in Russia through AKEC?
Yeah, so the students and parents can go onto our official website, which is akecindia.com. They can register an appointment. They can also go through the list of universities that we offer. They can also subscribe to our YouTube channel, which is AKEC India, and see the current students. They can also see the testimonials of the graduates and the postgraduates who are currently working in India. They can see their success stories. They can also hear the testimonials from our parents.
Amazing. Thank you so much.
Thank you. Thank
Thank
you.
Dr. Kamle.